Greetings, my name is Loiso Saliso and I am the founding director and projects coordinator at Kanyisa Gamba Projects, also known as GIP. You can actually find us on Facebook on the Kanyisa Gamba Projects page, not group. Our website is currently under construction and we will notify on our Facebook page when it is up and running. So, a little bit about the work that I do in feminism and my other side hustles. I am an intersectional, I actually identify as an intersectional feminist. I have been doing work around feminism for quite some time right now, and am actually the key initiator of the hashtag, the Total Shutdown March that took place on the 1st of August in 2018. And also, I've really done most of my work around sexuality and gender-based violence and femicide. I do my work mostly around sexual reproductive health rights, HIV prevention, and I advocate for social justice where working class and poor social ills are concerned. So that is why I actually identify as an intersectional feminist, because I believe that our struggles intersect one way or the other. As an activist, I actually got a bit frustrated during the COVID-19 lockdown because our work and our impact at the most is always when we are on the ground to put pressures on the powers that may be to change things that are not good or that are related to injustice. And the lockdown literally, policed us in doing that. I think even till now, the regulations are limiting us in terms of how do we advocate and get our voice out there. Everything seems to be going on a virtual platform, and majority of the people in which we interact with and advocate with and for are in the communities, and communities cannot afford to be on these digital platforms because, as we know, data is expensive. And so during lockdown, one of the things that I did to extend the work of advocacy, is that I launched a new clothing line called Unapologetic Wear, which is an intersectional advocacy line that actually, creates clothing that allows people to wear their truth. So our clothing have quotes that are related to either sexuality and gender-based violence and femicide, or mental health, or feminism, or social justice, or LGBTQIA plus issues, and it's all about extending our voice. It's about us still continuing to advocate without saying anything, and that is simply through us wearing our truth. So unapologetic wear is one of the lines that I started during lockdown to find a way of, I think, easing the frustration that our voices are not heard. And if we can put it on clothing and wear it everywhere, people always read what's written on your chest. So it's a way of extending the advocacy work by creating something that people can actually wear and have them wear their truth and have them wear their advocacy. You can go on our Instagram page, which is unapologeticwear_1, to see more of what these advocacy wear is all about. So Kanyisa Gamba Project has been a part of the Masibambisane project with the Foundation for Human Rights. It's been quite an experience. We have managed to do some work in Port Elizabeth, in the Zwide and Gwazakele communities. Very challenging work, but we did the best that we could and reached as many as we possibly could in terms of our advocacy and, getting people informed about SGBVF and really just working towards partnerships, not just with the community, but with certain key stakeholders in the region. And one of the first things that we did was that we did because Kanyisa Gamba has what we call community ground activists or ground forces. we had our ground forces go into communities, into the streets, and actually do a blitz in terms of letting people know about the Masibambisane project, what it is about, let them know who KIP is, and let them know what we are trying to reach with this project in us working together and creating a gender-based violence and femicide-free zones in these communities. And I think one of the things that came out of that is how, the engagement between the ground forces and the community members. They spoke to various age groups, various genders, about what the situation is in the community regarding gender-based violence. And it's a typical scenario where there isn't really much services for victims and survivors, where there isn't even enough advocacy around that. We also use this opportunity to let people know that we will be hosting sessions, community engagements, and we hosted two. One which was around inviting key stakeholders and talking about gender-based violence. We had the South African Police Services there. We had a representative from Tutuzela Rape Crisis Center, which is based in Doranginza Hospital. We had a representative from the community work in the Mandela Bay Development Agency was also there. And we really engaged on what work we need to do in terms of us working together, because we cannot continue working in silos if we really want to bring about change. So having the community there, holding some of these stakeholders accountable, these stakeholders also sharing key information in terms of what processes are in reporting cases. We had some fruitful outcomes from that session where the Mandela Bay Development Agency did say that they would like for us to continue partnering and working together in terms of coming up with more programs that could impact and get the community talking it more. Because I think one of the most critical things when we do these programs is that they need to be consistent in our communities, because we're not only there to speak, and we cannot always be there to run these programs and advocate for people, but we need to conscientize people about standing up for themselves, fighting against these injustices, and equipping them with the necessary tools for them to become advocates for themselves as well, and not always wait for Ulolo or wait for Kanyisigamba projects to come and advocate for them, but for them to also have enough knowledge about processes, about their rights, their constitutional rights, as to how do they also, if they are being misled at the police station, they are aware of the processes and they are able to say, but no, Sergeant, whoever, this is not how it's supposed to happen, this is how it's supposed to happen, and communities becoming their own advocates for their rights and against social injustices. So this was a very fruitful engagement in that sense. We had a mental health awareness campaign as well with a representative from the social workers in DSD, and honestly, that was a session that was very emotional and really required, I think, more social workers or psychosocial support. And it really cracked open the need, and the urgent need rather, of us having mental health services in our communities, because one, accessing these services for people in the townships and villages, for example, is near impossible due to they are not within their vicinities, the traveling costs to where they are, most of them are located, but also because of how expensive it is to get mental health support, seeing a psychologist or a social worker, and even the ones that are government run ones. It's a process for people to get psychosocial support. I mean, we had somebody share that they did go and ask for assistance, but it's been months on end where they haven't gotten the support. And, here is somebody with an urgent need to deal with their depression, to deal with their suicidal thoughts, but the services of social workers with our government services is not taking it with the urgency that it needs. And one of the things that we really came up with is that we need to start looking and pressurizing government in creating centers for mental health support, and not just for SGBVF survivors and victims, but also just for the community at large, because our communities are reeling with mental health crises and issues. And, this could also be an extension of creating employment for the hundreds of unemployed social workers and graduates that are sitting at home with no work to do, but having the skills to help our people. And so we are hoping that, as we continue to seek funding, that we will be able to actually get enough funding and partner with all the necessary stakeholders in ensuring that at least we start working on creating this mental health, because we need to heal our communities first. As much as we can go in and advocate for them, but there's a lot of healing and understanding what they need to heal from that needs to happen in order for us to actually conquer this fight against SGBVF and crime at large as well. So these are the things that we have done with Masibambisane creating GBV projects. It was a start, I think, to more work that needs to be done, more advocacy that is required to be done. And our wish, and even from the community, is that these could be ongoing, consistent programs, because there is a dire need for them and people need the support, because now SGBVF has become like a norm in these communities, and it shouldn't be that. People are afraid to come out and help victims when they are crying out. There's no longer community support, community react groups that could actually help people, because there's too much gun violence as well, and so people are not safe in every single way. I know that there was some young woman who mentioned how they are also not feeling safe even going to the police station, because these police are working, with these perpetrators, where cases disappear, where they get intimidated and so forth. So a lot of work really needs to be done in our communities. I think that we are doing great work by kickstarting these with this Masibambisane project, but I'm really hoping that there will be more, funds for us to continue doing this work regularly, so it can be instilled in our communities that SGBV cannot be tolerated. It can be conscientized within the people in these communities that, if you harm a child or a woman, the community will deal with you at large. And I think more trainings where community members are concerned need to also take place. And we're hoping that, in the near future, we can get more resources and more funds to actually kickstart the programs of mental health and training community members to be respondents in GBVF cases, together with the SAPS, supporting each other. And I think I've highlighted some of the impacts and the highlights through the program in what I've just said right now. People were really afraid to speak out about their experiences. There was breaking down in the mental health program, which I think, we know that it's always a touchy topic, and we need far more, I think, support for people in our communities when it comes to mental health and mental illness. Honestly, genuinely, and truly, we really need to prioritize this, because it is, I think, the underlying, factor, because I really feel that we also work in fighting GBV on a surface, basis, and not gunning for the roots of the root causes of these issues. And that's what we need to become intentional of, as the NGOs, as activists and advocates, as well as organizations and governments who are working and saying that they are fighting against SGBVF. That's what our intention needs to be, tackling this issue at the roots, the foundation, the root cause level. The challenges in South Africa when it comes to SGBV are endless. I mean, having been part of the total shutdown march, having submitted 24 demands to the government, we can say that yes, we got a national gender summit where there were certain declarations made, many of them not met. The 24 demands were handed over to the president, many of them not met. The NSP, which has, diluted the 24 demands into itself, is there. There's current talk shops happening. But the thing is that our government, every single time, when women and all the marginalized groups who are affected by SGBVF start rising up and challenging, the status quo, the status quo with regards to how, our crisis and the war on our existence and our bodies is being taken for granted, they always want to rock up like, oh my goodness, it's something new, or they act like it's something new. And yet there were women who came before the total shutdown, who came before us even, who marched against these social injustices, who marched against the war on our bodies, who marched against our suffocation, our oppression. And every time we march, their government wants to act like it's something new, and it's not. Because there was an NSP before the total shutdown, and it failed. And now again, there is another NSP, and it looks like we are going in the same direction, where there is just talk shops upon talk shops upon talk shops, and where there is so much exclusivity happening, because it's not all women and not all NGOs who are included in these spaces of having these discussions. The rural women are not there. The LGBTQIA women are not there. The sex workers are not really there. It's very exclusive, and, them not being conscious that this it has to be intersectional, because our struggles intersect as women. And so we find ourselves 3 years later, after the total shutdown, after the National Gender Summit, women are still dying at an incredibly alarming rate. The hate crimes against LGBTQIA plus are, ridiculously at a high rate, continuously. It's Women's Month, and women are still dying. I just read yesterday that a young woman was found in the bush after disappearing, having been, violated, and they made her eat or drink poison. And this young teenage child was found, luckily, but unfortunately, after telling, having the strength of saying what had happened to her, I think at midnight on the day that she was found. This was back in, I think, Udutywa in the Eastern Cape. At midnight, she succumbed to her pains, and she passed on. And this is Women's Month. So even these months that we are managed with, I would say, we are gaslit with, where our pain is romanticized, are not effective. And it is because our government wants to keep on tiptoeing around the necessary action they need to take. There's always way too much talking and way too little implementation. And what the fight against SGBVF requires is action and implementation immediately. And until this government and those who are in the so-called powers of changing, the legal systems, the policies, and so forth, when it comes to, perpetrators being let free, that's when we will see change. Right now, perpetrators do not feel like they are afraid of the consequences when they do perpetrate, because they know that the law is always in favor. I mean, globally, South Africa is sitting at number 1 for being oppressive against women, even on a legal point of view. This I saw on Google, where we are rated after Russia and Mexico, and so we are at number 1 for being the most oppressive country to women, even through the legal system. And this says a lot about where we are, even in the SGBVF fight. So, yeah, nothing, they want us to celebrate crumbs, but we've been celebrating crumbs for too long. Change needs to happen. Implementation needs to happen. Decriminalization of sex work needs to happen. If the president has said 2 years ago that there should be no bail for anybody who rapes or is an abuser or perpetrator, but today we're seeing bail happening and women who are victims walking and being intimidated amongst their perpetrators, then clearly, I don't know when will the president's word be effective or mean something? Is he intentional about fighting this fight? We have questions about that. We have questions about if this government really wants to see women being emancipated. And right now, it doesn't look like that. And that is exactly where we are with the fight against SGBVF, where we are being managed, where our pain is being romanticized, and there's nothing cute about that. I believe that right now our anger is valid enough. And I think beyond anything, I don't think we are angry enough. And that's what this country needs to see until it takes action to stop the war on our bodies. So yes, after all that preaching, I know this video was supposed to be 1 minute long. 5 minutes long, but I had to say what I had to say because we need to start speaking truth to power and not being apologetic about wanting our justice and wanting an end to our oppression and wanting to be free from these chains that we did not ask for but continue to bind us, because change can happen, but we are led by people who do not want to change these things. Thank you.